Friday morning. The South Shore's morning news continues. I'm Rob Hakala with Beth Foster. As promised in this segment, Dr. Eric Rightmire is with us from Plymouth Bay Orthopedic, providing immediate care to patients with urgent orthopedic needs. They have offices in Plymouth, Sandwich, and Duxbury. Visit pbortho.com, pbortho.com. And joining us on the line is Dr. Eric Rightmire from Plymouth Bay Orthopedic. Dr. Rightmire, good morning and welcome.
Hi, good morning. Thanks for having me.
Great to have you on WATD. So, Dr. Rightmire, tell us a little bit about yourself and what area you specialize in.
Yes, so I am a dual certified orthopedic surgeon in both general orthopedics and sports medicine. I did my training in the Harvard program and then out to California for the sports fellowship. And I joined Plymouth Bay Orthopedics in 2006. We're now based in Plymouth. We're affiliated with both Beth Israel Deaconess in Plymouth and the New England Baptist. And there's 9 providers currently, 9 physicians and 5 PAs, and we provide physical therapy, radiology on site. We have urgent care, CAS clinic, and we try to take care of our local athletes especially. I am associated with Marshfield. I have 3 kids in the Marshfield program, one at Ames Way, one in the middle school, and one in the high school currently. And I'm helping to cover the Friday night football games, the home games. I stand on the sidelines and watch out for injuries. Wow. Well, that's what a great career. And obviously it's wonderful to have family and you're out there ready to help student athletes and you work with athletes and really just people in general. And speaking of athletics, this guy as well, I'm seeing in his bio, loves skiing, mountain biking, tuna fishing, kiteboarding, surfing. Well, okay, so you know about what you speak about, Dr. Rightmire. That's for sure. So, absolutely. You see so many things. What are some of the common things that you see in your day-to-day work when people see you? So I deal with mostly shoulder and knee injuries, all ages, from pediatric knee to revision total joints in our older weekend warrior population. But the focus today, I think we're going to talk more about the high school, college age athletes and see a lot of overuse injuries, mostly, especially after the summertime when the kids are coming off of a relaxing summer, spending some time on the beach, maybe not being in the best condition when they hit the field. And we see a lot of ligament tendinitis or atrophy of some of the muscle groups around the knee that can sometimes lead to bigger injuries. So our focus is often to just make sure that the kids are doing the proper training and stretching prior to the gearing up for the big games. And then when the injuries do occur, a lot of meniscal tears, a lot of ACL injuries, shoulder injuries, instability, dislocations, that kind of thing.
Wow. Is there anything that the athletes or maybe the parents can encourage these young men and women to do to try to offset any injuries on the field? Like you said, maybe being a little bit less active in the summer can make, getting back into the routine a little bit more risky. So maybe some stretches. I'm just trying to think here.
Absolutely. There's a lot to be said for pre-season conditioning. Also, these days we see the kids focusing sometimes on one sport year-round. That's become a lot more common recently, whereas in previous years they would tend to move from lacrosse in the fall and soccer in the spring and play basketball or something in the winter. Now they're doing one sport year-round, and that tends to make them a little more prone to certain types of injuries. That's a good point. So there is still an argument for cross-training, even if you're not mixing up different sports. Adding some running and other more calisthenic-type activities, especially in the off-season.
That makes so much sense. Yeah, my nieces, they love soccer, but I guess there's fall soccer and spring soccer now, and then a summer league. So they're doing soccer all year round. I'm a big swimmer. That's a good point, though, when he's talking about doing one sport all the time, because you're obviously using a lot of the same things over and over and over and over again, as opposed to, you're right. I mean, sometimes in the spring and fall, kids would change sports, and I imagine that would be
a better way to kind of wear everything out, just kind of spread it around, as you're saying, Dr. Rightmire, instead of putting all the stress on one area.
Well, that's why a lot of professional athletes do yoga and Pilates, because it has that calisthenics that Dr. Rightmire was talking about. And so, because I love swimming too, and swimming is probably a great low impact to mix in with all of these other exercises. Would you agree?
Oh, absolutely. Yeah. I was a swimmer in high school as well. So, and I feel that it gave me certain baseline foundation that I've kept with me for the rest of my life, as far as being flexible and pretty well balanced. But you see a lot of the kids sometimes even doing track or running cross country in the fall to supplement their winter and spring seasons, and I love to see that. I think it's a great balance.
Yeah, that's very nice. That's a great point, and also can transcend into exercising in general when we grow older.
Correct. Yep. As we get older, it requires a lot more upkeep. You have to do your homework and doing things like yoga and stretching, and even just for a few minutes a day really makes a big difference. Yeah,
not stretching one time, I definitely notice it.
Right. I think that the vast majority of people I see with these overuse injuries rarely need surgery or anything invasive. The vast majority of them get sent to our physical therapy department.
Oh, that's great.
They work wonders.
Yeah, I'm a big fan of PT. When should someone decide to get in touch with Plymouth Bay Orthopedics? Like, if they're kind of like, I'm feeling a little bit of a pain in my knee after practice or anything, like, should they run and call you, or, is there kind of like a big red flag that they should look out for?
We are happy to see anyone as soon as they feel the need to be seen. We have pretty good availability. In fact, we also have an urgent care service where if you call in with an acute injury, you would be seen within 12 to 24 hours. We especially focus on the high school athletes for that. And it's always worth getting a baseline, if nothing else, even if it's a mild sprain that's going to get better in a few weeks. We're happy to check it out, and it's always, and then we can always initiate preemptive or preventative treatment, stretching program, or working with a physical therapist even for one evaluation to get into a routine to help prevent future injuries.
Oh, that's so smart. Did you say the urgent care place is open 24 hours?
No, it's just our office during our office hours.
Okay, great.
Roughly 8 to 5 on weekdays. We do have 24-hour call coverage,
right?
And we cover the hospital, but after hours it would have to be at the if it's really bad, emergency room. But other urgent care facilities have additional hours. We're specifically orthopedic urgent care during those hours.
Well, it's been great to have you on the program today, Dr. Eric Rightmire, with us, Plymouth Bay Orthopedic Associates. And again, dual board certified in orthopedic surgery and sports medicine. And remember those tips again about stretching. And we're all guilty of that. Certainly, at the younger age, we feel invulnerable. But even as adults, we're guilty about that from time to time. And all of a sudden, we have to go out and do some yard work or something like that. Oftentimes, we don't do the proper preconditioning, and that can get you into a lot of trouble. So, Dr. Rightmire, thank you so much for being with us today and getting the tips, and we hope all the kids have a great fall sports season, and thanks for your advice.
Oh, absolutely. Anytime. Thanks again for having me.
Thank you, Doctor.
That's Dr. Eric Rightmire. You want to find out more? pbortho.com, pbortho.com.